Hello viewers. Today we will learn mediastinum. Mediastinum, that is the middle space in between the two lungs enclosed within the pleural sac. We can compare mediastinum with the two-story building in which the main resident is Dadaji, who is complaining of all the time of having cold and so is wearing a pullover, that is the pericardium. Let's come to the boundary of mediastinum. Anteriorly, it is bounded by sternum, that is the manubrium sterni, body of the sternum, and the jiffy sternum. On both sides, as this is the space in between the two lungs, enclosed within the pleural sac, the part of the pleura which is facing towards Dadaji's house, two-story building, is the mediastinal pleura. So on both sides, lateral aspect, mediastinal pleura, and behind there is vertebra, T1 to T12 thoracic vertebra. So, we will know about the boundary and content of this two-story building. Dadaji, that is the head, with his son residing in the ground floor, and their grandson are residing in the first floor. So ground floor is inferior mediastinum. So its boundary below, this is diaphragm, the dome of diaphragm, that is thoracic outlet. Above, this is the imaginary plane crossing from the sternal angle in front, and behind there is lower border of the T4 thoracic vertebra, okay, or 4 thoracic vertebra, and on both sides the mediastinal pleura. So inferiorly, the immediate branch, that is the ascending aorta. Let's come to the member. In every family, there is husband, wife, son, and one lock. These things are essential, and there may be guard or it may not be. Husband is what? Which bring money in the home, and wife, it spends money, and the children, which in front they looks peaceful, but but behind they are very vagabond in nature. So this husband brings oxygen. So that is the husband brings money, and money, we can compare money with the oxygen, and no wonder in this COVID period you can understand how costly is the oxygen. So this artery brings oxygen gives oxygen to the tissue, and it carries the oxygenated blood away from the tissue. So the husband is compared to the artery, and the wife is vein, and nerve of every home is the children. So husband, now we are discussing about the superior mediastinum. Husband, that is the artery. They are all the time, and this husband is indulging with the WhatsApp and Facebook. So if you want a peaceful family, then stop chatting in Facebook and WhatsApp. Stop chatting Facebook and WhatsApp. So what will be the artery in the superior mediastinum? This is stop subclavian chatting, common carotid. In Facebook, B for brachiocephalic trunk, and WhatsApp app is the arch of aorta. Here is the arch of aorta, and the branches are in red color. This is brachiocephalic trunk, and here in the common cavity, then the subclavian, okay, and arch of aorta. These four you have to mention in the superior mediastinum artery. About the vein, which is compared with the wife, which all the time does bakwas shopping, that is blunder or stupid shopping, indulging with the. So just for making a peaceful family, stop bakwas shopping. Stop bakwas shopping. Stop, that is the superior intercostal, left superior intercostal vein. Stop bakwas, B for brachiocephalic vein, left and right, and shopping is the subclavian vein. Here is the, this is superior vena cava, and also one there is one upper part of the superior vena cava. So upper part, this whole of this is lower part of the superior vena cava in the inferior mediastinum, and this is superior mediastinum, upper part of the superior vena cava, and this is right brachiocephalic vein, and this is left brachiocephalic vein, and here comes the left superior intercostal vein, which is the branch of the left brachiocephalic vein, tributary. So these we have to mention in veins under the superior mediastinum. And what about the children? That is the nerve of the family. The children, which looks very peaceful in front. So in front there is P for peaceful and P for phrenic nerve. And behind in the superior mediastinum there is vagabond children, that is the vagus nerve. Vagus, that is, it is derived from a word vagabond. And there is one children that goes and comes recurrent. It takes recurrent path and always fight, लड़, ये लड़ता रहता है, always used to fight. लड़ना means to fight. So left recurrent laryngeal nerve. These three nerve comes under the superior mediastinum. And one lock. This lock is compared with the lymph node, which is for the protective value. It gives immunity to the, and it can be compared with the lock. So what lymph node precise in the superior mediastinum? It is Parvat, PBT. Parvat means mountain, mountain size. This Parvat size lock. Okay. So P for paratracheal, B for bronchomediastinal, and T for tracheobronchial lymph node. These three lymph node lies in the superior mediastinum. Now come to inferior mediastinum. What are the family members? Just look at this diagram. This is a two-story building in which the grandsons are residing in the. And one thing more, there is also additional item in the superior mediastinum as well as in the inferior mediastinum. Besides this family member and one lock, there is one guard named Susil. Guard, or you can say muscle man. So muscle lies in the superior mediastinum is Susil, SSL. Superior mediastinum, the anterior boundary of which only the manubrium sterni. So behind we have learned in the sternum that there is attachment of sternohyoid and sternothyroid muscle. So Susil, sternohyoid, sternothyroid and longus colli, lower part of the longus colli muscle. This is additional because they are the grandson, they are highly educated and they are very modern. So they keep guard in their home. Okay. So Susil. And one operation theater. No wonder this is COVID period. So there is operation theater behind. That is esophagus and trachea. One CCTV in front. This is CCTV. They are very modern. There is one CCTV in front. This you can see. This is CCTV for the protective purpose in the superior mediastinum in the modern family. So there is also the content of the superior mediastinum is CCTV. Just keep these two letter, that is TV, T for TV and T for thymus. It has also, both has got protective value. CCTV as well as the thymus which produces T cell for the immunity, cell mediated. And what rest is the drainage tube. This is drainage tube, additional item. tube for drainage, or you can say thoracic duct. So these are the content. And about the boundary, anteriorly manubrium sternai, on both sides mediastinal pleura, and behind there is upper four thoracic vertebra T1 to T4. Now come to the lower one, that is the inferior mediastinum. It can be divided, or it is divided into three components, that is the anterior mediastinum in blue color, middle mediastinum in which Dadaji resides in pink color, and in purple this is the posterior mediastinum. Anterior mediastinum is supposed to be the campus of this house. So the no family member, how can a family member resides in this space? Only few things lies in the anterior mediastinum. So what are they? There is one lock lies in the gate. So it is very tiny compared to this Parvat size lock, mountain size lock. So it is very tiny. So tracheobronchial lymph node. There is one lathi, you can say stick of the Dadaji, which is through by which it holds the door of this house like this from behind. Okay, so this is from sternum to the pericardium. So this is sternopericardial ligament stick, which is holded by the Dadaji, and one lock, and this is key. This key is what? This is the mediastinal branch of the internal thoracic artery. This is ascending aorta, arch of aorta, and then comes common carotid and the subclavian, and one of the branch of the subclavian is the internal thoracic. And this is the branch of the internal thoracic, that is the mediastinal branch of the internal thoracic artery, and supposed to be the key. So one lock, one key, one lut, that is the ligament stick of Dadaji, and the lower part of this CCTV, that is the thymus, lower part of the thymus. These are the content of the anterior mediastinum, which is supposed to be the campus of this house. Now come to middle mediastinum in which Dadaji resides. So what are the family members? Inferior mediastinum, campus, and the middle compartment, that is the middle mediastinum, and posteriorly in which doctor's son resides. So anterior mediastinum, there is ligament, lock, CCTV and key. Now come to middle mediastinum in which the most obedient son resides along with the Dadaji. So what is that? When we talking about the son, that is the husband, or we are talking about the artery. So, and it is he is very obedient and supposed to be the ideal pa or pita. That is the pa means pulmonary artery, pita, that is PT, pulmonary trunk. This is in white color, this is the pulmonary trunk, and this is right pulmonary artery, and this is left pulmonary artery. Okay, about the artery. Now coming to vein, that is wife. She is also very ideal wife, that always indulging in the puja and satsang. Puja, that P, Jad, puja, the pulmonary vein, and Jad for gyrus vein. Okay, and satsang as for superior vena cava. The lower part of the superior vena cava, this one resides along with the Dadaji in the middle mediastinum, and in the superior mediastinum, upper part of the superior vena cava. Okay, now come to children. So the ideal children, that is the peaceful children, one is phrenic nerve, and one children become the deputy commissioner of police, that is the deep cardiac plexus, resides along with the Dadaji. So these are the family member, and one lock is also essential, and lock is again the tiny lock, that is the tracheobronchial. And here in this anterior mediastinum, the lock is simply lymph node with the lymphatics. And here is the tiny, that is the tracheobronchial lymph node. And Dadaji used to and there is one additional item, that is the hookah. Dadaji, that is the heart, used to take that pipe for tobacco, that is called hookah in Hindi. So it is supposed to be the windpipe, that is the trachea. And what about the doctor's son? Doctor's son, that is there is one proverb in Hindi, सुबह का निकला अगर शाम में वापस लौट आए तो उसे भूला नहीं कहते. If going in the morning and returning back in the evening, then it is not said to be forgotten. So this is ascending aorta, then becomes arch aorta, and then descending thoracic aorta. So descending thoracic aorta, which is supposed to be the second son of heart, resides in the posterior mediastinum, and his doctor, that is DT. And we are talking about the artery, that is husband, DT, descending thoracic aorta. And what about his wife? That Jugaru. She can arrange everything. She has got every jugar. Very manipulate. She can arrange everything. So zygous, Jugaru means jad. That's it. That is azygous vein, hemiazygous vein, accessory hemiazygous, all type of zygous. And what about the son? That is, this doctor's son has got, he has got, is rich, so there is plenty of money, and that result into vagabond children. So vagus nerve, and he has also got 3 daughter, or you can say vagabond son has got 3 sister. As for splanchnic nerve, that posterior mediastinum has also got content greater, lesser, and the least splanchnic nerve. And what about the additional item? That is, he is the doctor's son. That's why he is doing operation. So there is O for operation, O for esophagus, lies in the posterior mediastinum. Okay, and there will be drainage tube, always lies in the posterior aspect. So that is thoracic duct. Tube for drainage, thoracic duct. And there is one lock also, and that is of prime quality. As this son is a doctor, so how can he can put a simple lock? So there is prime quality lock, prime lock, PM, posterior mediastinal lymph node. Okay, so these are the components of the posterior mediastinum. And about the boundary of the anterior mediastinum, first there is anteriorly, there is the sternum and the Gephiosternum, both side mediastinal pleura, and behind this is pericardium. Boundary of middle mediastinum, anteriorly the pericardium, or you can say anteriorly there is anterior mediastinum, posteriorly there is posterior mediastinum, and both side mediastinal pleura. And what about the boundary of the posterior mediastinum? Anteriorly there is middle mediastinum, posteriorly there is the thoracic vertebra from T4 to T12, and on both sides lateral aspect there is mediastinal pleura. Above, this is the imaginary plane crossing the sternal angle, that is the junction of the manubrium and the body of the sternum, and going up to the thoracic vertebra. And below, this is thoracic outlet or diaphragm. So this is the story of Dadaji, that heart. And about the mediastinum, that is two-story building. Thank you.